All right. Good morning and good afternoon and good evening to everyone, wherever you may be. Um, we are going to get started as we have about 90 minutes today. Time will go by fast. While you're joining us, please do add your name, organization, and the country, your country, in the chat so that we know who is in the room. It is my pleasure to welcome you to the PtD Supply Chain Workforce Summit. My name is Dominique Swinkels, and I serve as the Executive Director of People That Deliver. Today marks an exciting milestone as we inaugurate the PtD Exchange, a new global networked movement dedicated to advancing the professionalization of supply chain management. We have an engaging program prepared for you, and we have also invited a dynamic group of people to speak. So I'm excited to hear them today. The summit would not be happening without an amazing team, and therefore I would like to recognize the efforts of many of you, and that includes Jonathan Moody, Mandy Ramshaw, Kevin Eder, Andrew Brown, Kofi Nyame, Professor Anato, Sophia Hassan, and Alice Bates. So thank you. And this summit is also being held in collaboration with the Reproductive Health Supplies Coalition, RHSC. They are the global health partnership that first recognized the critical importance of supply chain professionalization back in 2009. And with that, it is my honor to introduce Martin Smith, the Executive Director of RHSC, who will now be sharing some opening remarks with us. So over to you, Martin.
Thank you so much, Dominique. An absolute pleasure to be with you all. And we couldn't agree more about the importance of the people that deliver exchange and the critical emphasis on the continued professionalization of supply chain management at this critically important time in global health within countries. And I was in New York last week, and of course, in conversations about reproductive health, people are quite fixated on the flow of commodities that might be stuck here or there in the supply chain. But in all of these conversations, I continue to remind any investor that would listen, that was interested, about the critical importance of a highly professionalized, a highly motivated, a high-performing supply chain workforce, and that workforce that is representative of the people that serve, that we have very significant proportions, 50-50 of that workforce that are female and male and non-binary as well, of course, and that we have significant female leadership in the supply chain space, and really emphasizing that the people that deliver are absolutely fundamental to that supply chain and to that system. And Dominique, as you said, we feel very honored as RHSC to have, been involved in a white paper that was developed back in 2009. It was called Improving Health Outcomes Through Professionalizing the Management of Public Health Supply Chains. And in that paper, the authors discussed the challenges facing public health supply chain managers in lower and middle income countries, and RHSC's commitment to tackling those challenges. And RHSC then went on to undertake a number of key activities to achieve that progress. We work with partners to create broad international support, promoting that professionalization with national institutions, educational opportunities for supply chain managers. And we put that into action around 2011. We made an innovation fund grant to Institute Bioforce Development. And that then developed further into a system strengthening working group work stream, which then gave birth to the People That Deliver initiative. And that grant was really fundamental in 60 organizations coming together at WHO HQ in 2011. And that was really got the ball rolling. It was wonderful then that People That Deliver successfully got that initial financial support from the UK Department for International Development There was a secretariat then that was set up, and the snowball effect, the ball got rolling from there. We as RHSC were very honoured to still continue to be part of People That Deliver. RHSC's director, my predecessor, John Skibiak, occupied a seat on People That Deliver's board of directors and helped to sort of move forward in terms of the terms of reference and the mandate. And all of this collaboration has continued in a wonderful way, in my opinion. RHSC's laptop initiative, which gives scholarships to young supply chain professionals to get them started on their supply chain journey, their public health journey, co-administered for a good period of time with our colleagues at People That Deliver. And so we're very, very proud of our role in furthering this cause of health supply chain workforce development. As I say, we feel that the People That Deliver exchange is coming absolutely at the right moment. We do recognize that this work is more important than ever for us to continue to advocate for this to remain a priority from lower and middle income country governments in these very challenging times. And it's critical to healthy supply chains, markets, and to evolving initiatives in areas such as regional manufacturing that we keep up the pace, we keep up the emphasis that People That Deliver has really given to our sector and shown in a leadership way over the last 16 years and counting. So for us at RHSC, for our part, we do really hope you enjoy today's summit. We hope that it will continue to strengthen our collective commitment to these worthy goals. And please do be reassured that RHSC will continue to be with you all, with us all, every step of this ongoing journey of progressive realization that we're all on together. So with that, really excited for what's coming along next. And back to you, Dominique.
Yeah, thank you, Martin. Thank you for those supportive words. They mean a lot to us. All right, so before we dive in, let me just cover a few housekeeping items. So as I'd asked before, introduce yourself in the chat by sharing your name, organization, and country so we know who's in the room. And I'm already seeing many of our friends there. So thankful that you're joining us. If possible, also make sure both your first and last name appear on the screen. You can adjust this by clicking the 3 dots next to your name. During the summit, all microphones are muted as well as cameras are off. So we encourage you to use the chat for any questions or comments throughout the event. We will do our best to address them. There's also simultaneous interpretation available, so select your preferred language from the interpretation menu. And then throughout today's program, we are also going to be using QR codes. So please have your phones ready with the camera function on, as the codes will link directly to both PtD tools and our sites. And then the links will also be shared in the chat for easy access. And then finally, a recording of the summit will be sent to all registered participants today. So that's just some items from the housekeeping list. So let's officially begin. And just sort of setting the tone, we are now operating in a very much changed environment. For many years, health supply chains depended heavily on donor funding for medicines, equipment, but also, of course, for human resources. But with declining aid and the shifting global priorities, countries are being asked to do more with less, but still deliver value to their populations. And this is the same reality that PtD faces. We're also being asked to do more with less. But as we know, workforce development remains a critical focus area. And so lately, what my motto has been is that we need stronger people, stronger systems. These lead to better results. And we know when supply chains are managed by professionals, they move from being reactive to becoming reliable. And through our advocacy, we've been able to elevate supply chain management as a recognized profession within health systems. And as you know, over the years, we've developed some respectable tools such as the theory of change, the supply chain management professionalization framework, and of course, our flagship leadership program, the Strategic Training Executive Program, STEP 2.0. This moment of transition means PtD is evolving from a coalition to an active volunteer network, and we're calling it the PtD Exchange. This decentralized model emphasizes collaboration, bringing together organizations and individuals to connect, share, and co-create. To support this, we have launched a digital community, which will be managed by B-Skilled, and we will continue to maintain the PtD website, where all of our resources remain accessible. To sustain these platforms, we are raising funds for community management and hosting costs. So if you are able, we invite you to contribute through the GoFundMe link. And before we move on into the program, I would like to reflect on this question. What will you personally do to keep workforce development on the agenda, globally and locally? This poll question will come at the end of the summit. And of course, we would then love to hear your input. So as you're listening to the speakers, it'd be great to think about what you will personally be doing to keep this on the agenda. And so with that, it is my great pleasure to introduce our very first panel, From Theory to Practice, Country Implementation of PtD's Tools and Resources. And moderating this discussion is Dr. Andrew Brown, Medicines and Vaccines Access Accelerated Advisor at Ganesh Aid. I've had the privilege of working with Andrew for over 10 years, and so I'm honored to welcome him as a moderator for this panel. So please remember to leave your comments and questions in the chat as you listen. Over to you, Andrew.
Thank you so much, Dominique, and fantastic that you're all with us today as we've continued this journey. I've had the pleasure of being on the PtD journey since 2009. I now have 4 grandchildren and my own children are married since then, and I have no hair. So this has been a great journey, but I think today what's exciting about this panel is we're going to hear about country implementation of PtD's tools and approaches. Tools that have been developed by this community, applied by this community, and which show great results. And tools which we know you as the ongoing community and us together can continue to implement. We're going to hear from Ines, who's the Rwanda Country Director from Chemonics International. And as we look at her context, we're looking at the application of the PtD theory of change to enhance workforce in Rwanda. Now, Defreki and Kevin, they're going to come together and help us unpack a bit more about the application of STEP, leadership and change management tool that has showed great impact in countries as local leaders become the transformational agents of change. And then Isaac and Wilson are going to come and we're going to have a little chat about the people that deliver professionalization framework and how they've been applying this framework in their context in order to make sustainable change over time. So let's get going on this journey together. Next slide, please. And please, as we move along, we'd love to have your questions in the chat, and our panel members will be free to do some of those answers as we go. For each of our panel sections, there will be one slide that will appear on the screen. Hope you've got your smartphone ready. Stop looking at Facebook, and you can have a look here at some of the QR codes as you listen intently to what's moving before. So Ines, let's move along. Firstly, what was the particular workforce challenge that you were trying to help address in Rwanda?
Hi, Andrew. Thanks. Hi, everyone. Good morning, good afternoon, and good evening. In Rwanda, I think just to talk a little bit about the supply chain system, Rwanda managed an integrated health supply chain for whole health programs. And the majority of the supply chain function at lower level, which is basically at health facility, are performed mainly by nurses and mostly female. And those nurses actually have inadequate skills and necessary competency to manage supply chain operation. In addition, those nurses actually are not dedicated to supply chain operation, they actually rotated across different services in the health facility. So this actually become very difficult for them to actually dedicate themselves to all the supply chain operation, including any electronic tool that are required to manage supply chain operation. So this has led to persistent stockouts of health commodity across health facility. And the Ministry of Health in Rwanda has been putting in place few short-term approaches for building capacity, which include like integrated support supervision, mentorship session, and continuous learning through a people-centered approach to address actually the gap in the workforce and the gap in the skills. Over to you, Andrew.
Thanks, Ines. And I think a lot of people, I saw them nodding, even though we can't see their pictures, when you were talking about some of the workforce issues in Rwanda. There's a lot of similar issues. And it was interesting that the Rwanda government saw the need to focus more on workforce. Now, in your role and in your project, you picked up the use of the PtD theory of change to help you in that work. Tell us a little bit about the tool and about how you applied it in your context.
Yeah, so we actually use the theory of change, the PtD theory of change, to first get a detailed understanding of the pathway of change that can connect the intervention that actually we were planning to select and the investment that is made by the Rwanda Ministry of Health. Actually, workforce development, it's one of the key priority in the national health strategy, where when you look at the theory of change outcome, it's very similar to what is in the national strategy. And second, we use the theory of change to actually map the 4 distinct pathway, and they're all listed in the slide there: staffing, skill, motivation, and working condition. Really looking at what is the necessary supply chain position and competency that we need at their field, right, across the supply chain. We also look at the working condition that can support performance of health supply chain worker. And we also look at what can motivate supply chain worker to do their jobs. So we actually look at that and we perform a study which result on, some outputs. One of the things that we did was to identify and select intervention. Some intervention inquire like creating policy and looking at all the human resource related process that are needed to improve supply chain workforce. We also develop a framework to be able to evaluate and monitor our intervention. And we actually pick indicator that can be used to monitor those interventions. So my organization, Chemonics, has partnered with the Ministry of Health to apply the human resource for supply chain theory of change. They've used a protocol that went through approval process by the Rwanda National Ethics Committee. And the methodology that were chosen involved actually different elements. So there was orientation of key stakeholder, which include the Ministry of Health and any other institution involved in supply chain implementation in the country. We also conducted survey and data collection to actually support the understanding on what is really required for us to put in place those intervention. There was workshop that involved different stakeholders to monitor the progress and implementation, but also some focus group discussion with different entity to better understand what are those skill set that is needed in the country to implement supply chain. Over.
Yeah. Quite a comprehensive approach with all those little steps being quite accessible. What really excites me about the tool is it not just focusing on development of competence. There's looking at staffing numbers, looking at motivation and so on, and you spoke about that. Now, there's a question in the chat, which I'll get you to get to a little bit later, but what's interesting to find out from you is this has been going on for a couple of years. Tell us a little bit about some of the results that you've been able to witness following this application of theory of change process.
Yeah, so just taking back, we first conducted a labor market supply chain assessment to also get a detailed understanding of the factor that affect supply chain, the supply actually of professional in Rwanda. We look at the demand and use side, but we also went abroad in looking at supply chain management industry, including health, humanitarian, private sector as well. And we've also considered a range of commodity during this assessment. So the assessment actually compared the status of human resource for supply chain management system in Rwanda against a complete set of outcomes that is outlined in the PtD theory of change. So we've identified that there was a need to strengthen this through target intervention. And as a result of the assessment, 20 interventions were recommended to improve the theory of change outcome that were not in place. So I'll just name few, quite a lot, results. We have developed a professionalization framework to be able to actually clarify roles and responsibility for supply chain manager at all levels, right, with the corresponding qualification. We handed over this document to the Ministry of Health, which they're actually using to inform the intervention and the investment that they are putting in place. In terms of forecasting supply chain position, including in the Ministry of Health staffing structure, a new organization structure was put in place that removed regulation from the Ministry of Health and keep pharmaceutical development and supply chain coordination specialists and experts in the organizational chart. So that was also one of the result and outcome of the theory of change implementation.
Very changeable.
So in terms of educational training, we have, I think the Ministry of Health has implemented a new qualification, which is pharmacy technician. You remember that I say that most of the supply chain operation at health facility were conducted by nurse. So there's a new faculty with the first cohort in place for pharmacy technician that were onboarded, and this will help us to fill actually the existing gap of qualifying supply chain workforce. We also, few more in terms of.
So just Ines, just give me your next one more, and then we'll move on. There's so much exciting things here, and there's also a couple of papers that can go in this in detail. But back to you, Ines.
Right. Yeah. And actually, when you scan one of those QR codes, it's reflect like the experience of Rwanda to implementing the theory of change. So one of the things I think I think this theory of change has also informed reform of institutions. So the Central Medical Store has been ongoing a reform to become a parastatal, and then they've used actually the theory of change outcome to be able to develop job description, clear job description for the staff. Right.
Thank you. So I'm just going to interject there because we need to move on, but Ines, so much rich information and a couple of key messages. One is about labor market analysis. One is about understanding supply and demand. The other is about the 4 pathways and then laying the foundation for ongoing change. So thank you so much, Ines. Next slide, please. So I mentioned in my opening remarks the importance of transformational leadership, transformational change. STEP, as a number of you on the call will know, is a key tool that's used in this regard. And we have the pleasure of having Nefreke Gode with us, the Program Coordinator of Africa Sales and Partnership from Zipline. Hi, Nefreke. And then none other than Mr. Kevin Etta, the Senior Consultant from Gavi. So welcome to you both. And my first question is, what is STEP trying, what gap is it trying to address? Over to you both.
Well, Andrew, if I can step in here real quickly, and then I'll turn it over to my colleague, Freki. Really what we're trying to do, I think back to just a few moments ago when Dominique's opening statement. She said, in this changing environment, we're going to be asked to do more with less. Well, it occurs to me that yes, that we do need to do more with less. But in doing so, very often the less is we do less training, we do less investment in the workforce. And I think the key message that we've got to remember here and that we need to take from this webinar is that investments in the workforce are absolutely critical to the investments that countries make, donors make, implementing partners like Chemonics make, because without the investment in the workforce, all the other investments become suboptimized. And STEP is one of those programs. We have recognized at STEP that we absolutely, to remain relevant, we have to be nimble, we have to be flexible, and we have to adapt to changes. And that's the process we're going through. Over to my colleague.
Yeah, thanks, Ifriki. And in your answer, if you could then move on to telling us a bit more about what the tool is, what STEP is, and would be great. Go ahead.
Oh, thank you so much, Andrew. Thank you so much, Kevin. So the STEP program, just like Kevin had mentioned, came to ensure that Zipline and the state's partners develop and implement a multimodal supply chain system with the use of drones for deliveries. That was the main goal of the STEP program in Nigeria. And Zipline is operational in Kaduna, Cross River, and in Bayelsa. So in order to do so, to developing and implementing a multimodal supply chain system, we needed our stakeholders to understand how to fully utilize us. Yes, we had launched drone services in the health sector, but the question remained, do our stakeholders fully utilize our services? Do they understand how much more they could use our services for? So we had to bring the problem forward, which was one, using drone services to reduce vaccine wastage through on-demand delivery. And the second one was last mile delivery efficiency in disasters and emergencies, still using drone services. So, yeah.
Yeah, and I think what's exciting is that the subtext of what you're saying is that without leadership and change management competencies, what you wanted to achieve wasn't possible. Kevin, can I ask you to come in here and help us unpack a bit more about the STEP as the tool, the program, as you call it?
Sure. And STEP is more than just training. STEP is essentially a 6-month program divided into 3 different phases. It is intended for, and the target audience are public health officials, and specifically public health officials that have responsibility and influence over supply chains and supply chain operations. So one of the, and when we think about that, you've got a program, you've heard Andrew say it's a leadership and a change management program. So you could actually combine those two, because really what we're trying to do with STEP 2.0 is we're trying to lead change. We're trying to lead transformation. And so the aspects of the program are twofold. There are basically 2 models that we follow. One is a leadership development model, and we call that stages of team development. It really teaches you how to work within a team and work as leading a team. But then all of that is great, for us to be able to increase those competencies, but without demonstrated results, without a tool to apply those new competencies to, those new leadership competencies, anyway, that's why we've also included a change management tool called Cotter's Cotter's change management model. So you're layered in, you've got a team building, team leadership, training in there as well. And then that's layered on top of a really applicable tool for change management. And Andrew, the last thing I'll say is what we're trying to do is we've really STEP to this point, and it's been done now, there's been 35 programs since 2014 or 2016, and all of those programs really focused in heavily on those leadership competencies. What we're going to do now in recognizing the changing environment is we want to pivot that. We're not going to shy away from the leadership competencies and everything, but we have to lead with the change management piece. And that's what you're seeing, and that's what Freki is outlining to you with what we're doing in these 3 states in Nigeria. We start out with an operational problem, an operational issue that needs addressing. There's a significant change. The disruption is the introduction of drones into a multimodal supply chain network. So we're focusing in on that first, and then with the leadership competencies to follow.
Yeah. Thank you so much, Kevin. And Frankie, I'd like to ask you to come in here because you've got some clear outcomes that you're wanting to achieve as part of this deployment of STEP. We're now sort of into phase 3 of this current deployment, but please share so far some of the results that you're already seeing in the context of the state conversations with the participants. Over to you, Frankie.
Oh, thank you very much. One very clear outcome that we've been able to see so far is positioning Zipline not just as a logistics company, but a system for timely deliveries, accurate demand forecasting, real-time disease surveillance, as well as expanded coverage and ultimately improved health outcomes. And a lot of times the breakage that we see in the supply chain system, especially in some states, one of the model that is being used is the push model, where a lot of commodities are being sent out and it's not based on actual needs. So that's what we are trying to solve. And so far, so good. We've been seeing conversations going on very, very well with key stakeholders, and we are so excited to be doing this. So, yeah.
Yeah. Thank you so much. And we'll come back. There's also a couple of papers around STEP that have also been published to talk about some of the key changes in the workplace that have happened. And STEP, exciting program. Thank you so much, both of you, for sharing with that. I'd like to move to our next slide, please, and move to Isaac. We're excited that Isaac is here, Dr. Isaac Muwa. He's a senior pharmacist, quality assurance and supply chain, who's an independent consultant. And you've been working with your colleague, Wilson, who unfortunately has been unable to join us at the last minute today. So we wish him well. But I'd like to ask you, Dr. Isaac, what was the particular workforce or supply chain workforce issue you were trying to address in your context?
Yeah, thank you very much, Dr. Brown, and saying good morning, good afternoon, everyone. I think it's a great opportunity. And to address the question, from a very practical point of view, is that there's a saying which goes that the customer is the ultimate judge of quality or the need that is required. There has been, observed mismatch in terms of the industry needs and the kind of quality of personnel that is going to the place of work. That mismatch arises by the fact that the learning institution or the institution of higher learning, they have not been able to quickly, address or adapt the changing or emerging needs within the industry. And therefore, there's been a major issue of training and educational gaps in terms of needs. And maybe another aspect that has been observed, of course, is the issue of career pathways. When it comes to workforce development, and particularly for supply chain, there's been a major challenge when it comes to designation. You start career entry from, sometimes you can even start as a manager, sometimes you can start as an associate. There is no a very distinct, consistent way of having, a very clear ladder of professional development and career progress. And maybe lastly, as I submit the issue of motivation and recognition in terms of job description for the supply chain managing professionals, I would say that it's not a bad thing to have all of the person from institution of higher learning joining career place or career marketplace, then again there has to be a minimum requirement. You can't have a very critical role like maybe procurement having some generalist kind of training just coming in. So I think those
Yeah.
are some of the major issues that we've been trying to address, among others. Thank you.
Yeah, thank you. I think with the theory of change in Rwanda, we're looking at how to optimize the workforce in that organizational context with some reference to overall workforce systems aspects. With the STEP program, we're looking at developing leadership leaders to make change happen. And in your context, the professionalization framework is about systems change, as you say, for different ladders of career, for supply and demand again. So help me understand a bit more about the supply chain management professionalization framework for people that deliver. What aspects were you using in your context?
Yeah, I must say that I'm one of the maybe few, if not beneficiaries of the tools that have been developed by the people that deliver. And when it comes to the professionalization framework, I usually call it the golden horse of workforce development. Because it's a very well thought tool in the sense that when you are trying to do when you're coming up with a professionalization strategy, then it can give you a very systematic steps on what to follow. I've been able to deploy this tool in my previous assignments with people that deliver in South Sudan, doing a professionalization development plan for the country. And in particular, this tool has helped, we usually call it the race track. It is able to give you where you start with the situational analysis, like sort of doing a gap analysis to establish what is the baseline at the country, what are the existing challenges, what are the enabling factors. Then from there, it also gives you a very clear thought process of how to engage the stakeholders, how to map them, how to do the analysis, how to do advocacy when it comes to forming up technical working groups. And most importantly, once you engage these people, the stakeholders, the advocacy, you need to develop the implementation plan. So the intervention that will do to actually augment the professionalization process. So it will tell you how to do the implementation, the costed implementation plan, the project charter, etc. And of course, ultimately how you need to conduct continuous improvement through monitoring and evaluation. So I find this tool in particular quite important and quite indispensable for anyone who would want to start the process of professionalization framework or strategy within any jurisdiction. Yes.
Thank you so much, Isaac. And I think one of the reflections we're getting from each of the speakers is that aspects of workforce strengthening are complex. And these tools help to break down and open up thinking to people that are not used to working in this space. So thank you for sharing that. Before we close out your particular case study, Isaac, can you share with us some of the actual changes or results that you've seen with the work you've done in either South Sudan or what you've observed through Wilson's work in East Africa? Back to you, Isaac.
Yeah, yes, thank you very much. I've had the honors of spearheading supply chain professionalization in South Sudan and currently at the ESC, East African Community. And maybe just to begin with the former, that is in South Sudan, one of the key things we were able to spearhead there, of course, is to have the project charter. And the project charter is a very powerful document in the sense that it forms the basis of endorsement by commitment by donors. We had UNICEF playing a very critical role, and we presented this document through UNICEF and, of course, the government of South Sudan. And from the leadership that we have in South Sudan, they have used this tool and they are planning to use tool as a mobilization resource mobilization tool in terms of getting funding. So I'm very proud and very, very happy that the work that we have done is now being used as a beginning area to fast track and implement other issues. The other aspect that we were able to spearhead, of course, establishment of the task force within South Sudan, because at the moment it was not established, but through engagement with the government there, we were able to have a steering group or technical group to spearhead the interventions that we proposed. Then lastly, as I submit within the ESC, the work is still ongoing. But one thing that I'm happy is that even right now, as we undertake the work at ESC, which is basically the development of professionalization strategy, we are adopting a lot the knowledge that we've been able to garner from South Sudan. So ideally, you would expect that the ESC will be cascading this knowledge to South Sudan. But then again, it's like a bottom-up kind of knowledge sharing and adoption, which is quite encouraging. So I would say that that kind
Thank you.
of knowledge sharing within the region has been quite, anti and indispensable through the process. Yes.
Thank you so much, Isaac. And again, there are some papers that have been published by people that deliver in their experience of this framework. Also, some interesting work happening in Nigeria and Mozambique with the professionalization framework. Okay, folks, so you've heard it here. 3 tools for people that deliver that have been applied in different contexts. My last question, I'm going to ask each panelist this question just to give a short, sharp answer. We have a number of country professionals seeking to improve their workforce systems. What's one particular piece of advice you'd give our participants as they seek to apply people that deliver tools? Ines, can I go to you first?
Yes. I think applying those tools, especially I'll talk because I've been speaking about the theory of change, really help to optimize the intervention, right? I think most of the country have been reacting to challenge and to fill the gap, but not really in an optimized way. So I think this help really to develop like sustainable strategy in intervention that
Great.
can actually improve and the gap and the health outcome in country. Over.
Thank you. So Nefreke, you're new to the use of PtD tools. What advice would you give so far?
Okay, for me, I would say discussions alone would not solve a problem. We have to deliberately turn those dialogues into smart goals using the quarter transformation model, just like Ines mentioned, and follow through with our stakeholders just to ensure that the change that we are looking for is actually successful. So, yeah.
Great, thank you so much. Kevin, a key message for our folk today.
The key message, I said it at the beginning and I'll say it again, and as alluded to it, countries, any investment that you make is suboptimized if you don't prioritize the workforce development aspect of it.
Thank you so much. And Isaac, you've been applying PtD tools for some years now. What advice would you give our participants? A crisp message that's practical in nature as they seek to leverage PtD experience?
I would say that this tool needs to be tailored with the data in terms of a country context. Each country is unique, and therefore it's important that as the tools that they are being used, they are optimized together with the specific data landscape in each of the country. Thank you.
Great, thank you so much. And there's been a number of questions in the chat, and I would encourage our panelists to have a look at the chat and to respond to those questions. Please keep your questions coming. So in this panel, we've been on a journey together where we've tried to spotlight 3 of the people that deliver tools: the theory of change, the STEP program, and also the professionalization framework. The experience of those on the panel and many more is that these tools help us to break down an understanding of workforce challenges than just simple, let's do more training, to understand the complexity of these workforce systems, but in a structured and interactive way, move into country context with local partners in order to create change. We hope that you will be looking at these tools yourselves in order to have a look at that. One of the things that in Ganesh Aid we focus on is looking at innovation and modernization. What can we do to make change happen? And I really think that the tools we've spoken about today, when applied, can make that change. Please join with me. Please, with your cursor, go to the bottom of the screen, find the React button and choose an icon that gives some love and congratulations to our speakers today. And I want to thank you so much for being on our panel. And Dominique, handing back to you. Thank you so much.
All right, thank you, Andrew, and thank everyone for your comments in the chat. I think there's a few comments there that we still need to respond to, but I also want to just highlight those that have joined us during this first panel. If you have not yet, do add your name, organization, and country in the chat. We'd love to know who is in the room. My colleague Mandy has also put in links to the different articles that have been published in the Global Health Science and Practice Journal. So do take a look at those. And then we're going to go on to our second panel, which is keeping workforce development a top priority for countries and donor organizations. And therefore, I'd like to introduce Kofi Nyame, chair of the People That Deliver. Kofi and I have worked even longer together than Andrew and I. In my counting, it's been 18 years. So that's quite a bit. And so I'm very honored to have him moderate this panel, especially really looking forward to hearing how do we keep that political momentum going, keeping workforce development at the policy level. So let's hear from our panelists. Please remember to leave your comments and questions in the chat as you listen to this panel. So over to you, Kofi.
Thank you so much, Dominic, and thanks, Andrew, and the panelists for panel one. I want to say good morning once again, good afternoon, good evening to everybody as we convene here. I mean, we have listened to the first panel that has given us some specific implementation of some of the PtD tools that we have developed along the line. This panel is going to focus on the future. How do we ensure that there is still an interest, there is still a focus on workforce development as a priority as we move on to this. And as has been noted, workforce development is a critical enabler, and without the workforce, we are not going to go forward the way we want. We can have all the strong policies, we can have all the infrastructure and financing, but without a skilled workforce and a motivated supply chain, we are not going to move forward. So this panel is going to take the various aspects of it from the government perspective, donor, regional actors, etc., in order for us to look at how do we keep this agenda going for the next few years as we move on. So we're going to have a panel of esteemed gentlemen and one lady. We have Jacob who's a lecturer at the Kwame Nkrumah University of Science and Technology in Kumasi, my alma mater. He focuses on supply chain information systems, and Jacob will bring the academic angle to the discussion and focus on the PtD professionalization framework. Welcome, Jacob. We also have Dr. Stanley Chidove, who works with the Global Fund as a supply chain manager, and he brings a deep donor expertise and experience applying the PtD theory of change that we heard of, and he'll be focusing on how do we align the investment, sustaining funding, and governance as we move forward into the next phase. Third on our panel is going to be Maria Tala Jallo. Maria is a fellow. Maria is the chair of the Vizuri Health Dynamics, an innovative African nonprofit foundation that works across pharmaceutical value chain and catalyze positive market dynamics that enable the scaling up of medicines manufacturing across Africa. Tala will bring the regional manufacturing and future perspective to human resources for supply chain management, particularly as it impacts on local manufacturing. We'll also have Paul Alvani, who is the founder and chief executive director of the Empower Group, including the Center for Leadership Development, Center for Digital Learning, and the Empower School of Health. Paul leads the Step 2.0 Global Health Capacity Building leader and a strong advocate for embedding leadership into workforce development. We had hoped to have a government colleague join with us, but unfortunately, he's been called to other present duties here. So I welcome my panelists, and then we'll take it from here. Great. So we would approach this panel from a different perspective. We will do 2 rounds. The first round, I would ask each of my panelists the question as to why do we prioritize workforce development, and from their perspective as a donor or as academic, or as from the regional or from the perspective of leadership training. And so we would start with Jacob. So Jacob, from your perspective, why should workforce development remain a top priority in supply chains strengthening?
Yeah, thank you, Kofi. Good morning, good afternoon, good evening, depending on where you are connecting from. It's an honor to be here to share some few perspectives on the discussion on board. As you rightly put it, from the academic perspective, without the right human resource for organizations, particularly within the context we are discussing, the healthcare sector, there cannot be any program that any health organization can implement without the right skill set to ensure that our health systems are providing the needed, quality commodities, ensuring that they are available at the right time, ensuring that they are stored in the proper way that will safeguard their quality. If we do not have these cadres and mix of expertise within the health ecosystem, we cannot prosecute any healthcare delivery. So yes, it is important that countries, and for that matter, organizations that are providing healthcare services prioritize the development of the workforce in terms of their skills, in terms of giving them the right, motivation, in terms of giving them the right, working conditions that will make them give out their best in realizing whatever health interventions that they need to provide. And just to give a bit of context, as PtD is one of the, fiercest advocate for workforce development, and from some of the information I've gathered based on my review, it is important to put in context that Africa, and for that matter, Ghana, is even in a dire need for some of these workforce development, because within the African context, we are looking at a little over 3% of the workforce within this context, where we are having over 25% of the disease burden in Africa. And so therefore, in our context, it is even more imperative to prioritize workforce development, ensuring that from the national level, regional level, down to the service delivery point, we have the right skill mix, we have the right professionals providing the needed leadership, providing needed, support to ensure that clients that need services from these healthcare providers get them quick and within the right affordability. And just also to give a context also, it's important that we look at the various training related issues, because as it stands now, governments of most of the countries, especially within Africa and for that matter Ghana, have so much stake in terms of recruitment when it comes to the public health system. So prioritizing workforce development, be it from the academic perspective, as I mentioned, or even from all year-round CPDs, are critical, because the health ecosystem keep evolving by minute by day. And therefore, keeping the workforce abreast with the emerging health technologies and systems will keep them abreast with the issues and be able to drive the health ecosystem to the level that provides the clients that they provide services the best of care. This is what I can say. Kofi, over to you. Thank you.
Thanks, Jacob. Yes, keeping the workforce abreast of the systems is actually important indeed, and so we need to continue to drive that. Stanley, what would be your perspective?
Thank you, Kofi, and morning, good afternoon, and evening, everybody. I think firstly, I want to recognize the critical role that PtD is playing, or has played over the years, in strengthening the health supply chain workforce, which is really critical. And we really remain committed to continue to support the initiatives in the practical uptake of the tools. So in answering the question, I think it's very, very important for us to recognize the need for integration of the tools and workforce agenda in the national systems and the strategies. Is Global Fund, as we continue to work with the Ministries of Health and the Ministries of Finance in the implementation of our grants for Grant Cycle 7, as well as preparing for Grant Cycle 8, which is coming up. We continue to emphasize the need to embed the tools and also the agenda on workforce development within the national health workforce and the supply chain strategies. This really is critical to ensure that the appropriate funding can be sourced, but also ensuring that these strategies are aligning with the broader health system reforms that are being developed for different countries. I think to emphasize this, I think the theory of change, as you mentioned, Kofi, and which was discussed earlier, I think it's really, really practical and very, very important, together with any rapid assessment tools that are already available on the PtD website, to ensure that we can guide systematic assessment of the needs for different countries, as well as putting together and supporting evidence-based funding requests. It also makes it very critical to ensure that when we do any technical assistance that we are providing or that is being provided by our partners, we use these tools to adapt and contextualize to the countries to make sure that they are relevant, and then making sure that they are not standing alone as PARO initiatives that are not speaking to the broader tools and focus. And then lastly, is the need for mobilization of co-financing arrangement, because without funding for all of this, whether it's coming from the government, also coming from the donors, this does not really speak to sustainability. So co-financing arrangement with national governments becomes very, very critical to ensure that there's that long-term sustainability, reducing donor dependence, but also enforcing local ownership, really making sure that this remains a priority as part of the agenda. Over.
Thanks, Stanley. Yes, spotlighting the importance of embedding these tools and aligning with workforce or larger healthcare reforms and financing is key. So Tala, can you speak to us from the regional perspective, local manufacturing perspective, why there is the need to continue to prioritize workforce development?
Thank you very much, Kofi, and hello to everyone. I can start by saying that I think I'm one of the few people remaining standing when PtD was being established. I was at the global front end, and I recall the first meeting we had in Lyon talking about the need for workforce. So many challenges within supply chain, so many challenges. I don't even think it's supply chain, it's just access of products, healthcare products to populations, right? And a lot of it is linked to the skilled workforce we had. And that was why PtD was established. And it still remains critical. So keeping it a priority is a done deal. We have to keep it alive. A lot has been invested into it. And what we need to do now is, unfortunately, we have to keep up with the dynamics as they evolve. And looking at what has happened with regional manufacturing, for so many decades, everybody was talking about regional manufacturing in Africa, but very little was being done. Now we have got to a stage where a lot of people, since after COVID-19, realize the need to have a more resilient and self-sustainable manufacturing industry in Africa. And when we talk about workforce development, I'm glad Stanley brought it. It's an investment. We cannot achieve, whether it's universal healthcare, whether it's access for all, we call it, or whether we are talking about sustainable manufacturing systems in our continent, anywhere, without that workforce. So for us within the regional manufacturing perspective, where I'm speaking from right now, we are looking at workforce development as an inherent part of expanding the scale and capacities of manufacturing companies to be able to meet the needs of the continental priorities. And it has to be seen as an investment. When we are talking, we shouldn't just keep it, we tend to look at workforce development as an isolated component. When you deal with all the issues you have, because there are so many challenges, you prioritize them and then say, oh, but by the way, we also need some capacity development. No. If we are really serious about this, we need to make sure that it is part and parcel of that package. And this is the message we should share with government, with investors. You cannot invest in a manufacturing plant to improve on their standards of quality, to become a top-notch pharmaceutical manufacturing plant. You cannot invest on new equipment. You cannot invest on all the other things, giving the money for them to be able to expand on their product portfolio if the workforce that is needed to keep it going is not there. look at what is happening. We are still behind in a lot of areas. When we talk about voluntary licensing, the first thing people talk about, but you don't have the capacity for tech transfer. Where is the workforce? You need to scale up, but we don't have people who have the supply chain expertise to be able to make this manufacturing plant become cost efficient. So this is a priority, and we have to make sure that we don't keep it isolated. We have to keep it within the general area of all the other enabling factors that will make us succeed in this area. Thank you.
Thanks, Stella. Yes, this is indeed a priority. And without workforce, there's no local manufacturing. Thanks for that perspective. So my good friend, Paul, what's your take?
Thank you so much. You can hear me okay?
Yes, we can.
Great. Again, just to add to the chorus of my previous speakers and friends who talked about the vital role that PtD has played and is playing, and will continue to play in these changing environments in terms of workforce development. I'm going to focus more on what we heard in the first panel, which is on the leadership aspects, and focus a bit more on STEP as well, and then I will continue with those remarks. But as you mentioned, the role of leadership and workforce development. Let me start with a quote from Andrew Carnegie. And for those who aren't familiar with him, he was a Scottish-American immigrant from Scotland to America, came with nothing. We're talking about early 1800s or late 1800s, early 1900s. And rags to riches story, and then later he became the biggest philanthropist. And his contribution, biggest contribution, among others, was 2,500 libraries that he gave to the American public. In a way, what PtD has created and is creating is a massive library for people who are interested in workforce development. And Andrew Carnegie's quotation was, "Take away my people, but leave my factories, and soon grass will grow on the factory floors. But take away my factories, but leave my people, and soon we will have a new and better factory." So really talking about the importance of people. Everything else can change, but if we focus on people, we'll get there. So just to highlight, when we speak about leaders, we often think about ministers of health or director general of health services. But when we talk about STEP and when we talk about leadership and the work that Empower does in partnership with PtD and all the other stakeholders, we're also talking about heads of HR, heads of training, and even heads and managers of teams. As long as you have more than 2 or 3 people that you're managing, you're a leader and they look up to you. So in terms of roles of leaders and the work that needs to be done, it's really for them to set the vision, the goals, and the priorities, and then help the organization to prepare and adapt the organization to succeed. Of course, there's technology, process, infrastructure, and then people, as I had mentioned. And the tool and everything related to that is, again, back to the PtD website, which is on the leadership. It talks about the how and the what this can be done. Thank you. Back to you.
Thanks, Paul. Yes, I really like the quote from Andrew that we would build a new and better factory. Yes, the landscape is changing, the land is slippery. But I think we've heard from all our panelists that there is the need to continue spotlighting the workforce. There is the need to continue paying attention to workforce development, and this needs to continue to be a major priority for all sectors, for all stakeholders, whether it is academia, leadership development, local manufacturing, the donors, or the government. Thank you so much. So we'll more shift to the second round of focus, and where we will be looking at how we're driving implementation with PtD tools. We heard the specific implementations that have been done in Rwanda, Sudan, and also in the Nigeria for the ZIP thing. So now we need to look at the future. How can PtD tools and resources help us drive implementation and make workforce development a reality? We have these tools, we have these resources. They are currently available on the PtD websites and will continue to be there for the foreseeable future. But without a PtD secretariat moving into the exchange, how can we sustain these tools? How can we ensure that they get used? Jacob, from your perspective.
Yeah, it's very important to make this point that PtD's work so far has really been useful and helpful, not only within the professional space, but within academia. And I just want to respond to this by giving you a context. And I recall just about 3 years ago, when we were supposed to look at issues on trying to upscale the skills mix and develop the professional base of Ghana's healthcare supply chain. In the course of our engagement as academic, we had to fall on a lot of the work that PtD did, especially with the supply chain workforce framework. And I really want to pay a lot of respect to the people that worked on this framework. So for instance, adopting the logic behind that framework, we had to do a lot of engagement. And basically, I want to share a few things from it. So based on the engagement, we decided to understand what the issues are as far as the competencies that were required for the development of whatever curriculum we needed to come out with to support the development of the supply chain workforce. And through such engagements with the various stakeholders, including Chemonics, and in fact, Chemonics gave us a lot of insight. It is through Chemonics we had insight about some of these PtD stuff, and we adapted it so much. And through such engagement with the stakeholders, including the various government-related institutions in terms of the Pharmacy Council of Ghana, and a host of other professional bodies, including the Health Services Supply Chain Practitioners Association. We went further to do the next step, which is about designing a curriculum. Because after engaging all the multiple stakeholders that we believe must be considered in the design and trying to help address the workforce challenges we had, including industry, including pharmaceutical manufacturers and importers group in Ghana. After that exercise, we now have to do what we call the design of our curriculum through benchmarking of various, African context programs that we're already running, and then we look at global related programs that we're already running. And from that engagement, we decided to develop the curriculum, as I said. After designing, then we had to go back and get the stakeholders' input. Because remember, the idea is trying to help use that framework to see how we can get everybody to own whatever we are coming out with as a program to be used to train healthcare supply chain professionals within Ghana. And so during that engagement to review the curriculum we did, we had people like the Pharmacy Council, the Chemonics team were in there, the USAID team were in there, the pharmaceutical manufacturers team were in there, we have the government hospital pharmacists group were in there, and the host of other cadres of healthcare supply chain professionals, just to make sure that what we are coming out with is going to help make them more efficient in what they do, and also train other emerging supply chain professionals that don't even have the capacity that the current group we met at the time have. And after that engagement, we had to go through another engagement to get the Ghana Tertiary Education Commission to give us approval so that we can now launch this as an academic program. And what am I talking about here? Currently, as I speak, through this framework that we adopted, we're able to come out with the master's program on healthcare supply chain management, pharmaceutical supply chain management, and the BSc program on healthcare on pharmaceutical supply chain management. So the supply chain professionalism framework is one key intervention that any institution, be it academia, be it the training institution within the professional space in the health sector, can use And I encourage everybody, because we actually from academia, you know how our systems work. But we found this tool very, very useful, because once, if you don't engage, you will not appreciate what the issues are. Right. And it is through the engagement that you can now properly design something that is tailored towards addressing those needs the people have. And once you design, you cannot just implement in a vacuum. The implementation should be in line with the needs and expectations that you engage others to. But the sustainability is key, and this is where I want to highlight, because that is where we have a challenge, despite the fact that we did the engagement, we did the design, we implemented. The sustainability is about getting the right national stakeholders. For this matter, we're looking at the regulatory bodies, the employers, Ghana, the Ministry of Health, because now we've trained people. First batch graduated just this June. But the question is, how do we get the Ministry of Health HR to actually now actualize what they actually promised from the design stage, that we need these cadres, we will integrate them into the health system, we will give them the necessary positions, so that while they're trained with these expertise, they can be able to be, they can be faced in different levels of the health system to deliver healthcare and supply chain services that they need. This is where we look at the sustainability aspect. Thank you.
Great. Thanks about the sustainability piece there. Stanley.
Yeah, I think I look at it with three words: measurement, accountability, and advocacy. I think from a measurement point of view, I think driving the implementation of the tools centers around using the indicators that have already been developed, or developing work plan tracking measures that are really centered on the tools that they've already been developed to ensure that we can track progress, but as well at the same time link those measures to the approaches that are being used to really show that return on investments and progress that is being made. On accountability point of view, I think it's still using those indicators as for accountability, but using the earlier point that I made around the integration of the tools into the national strategies themselves, and using cross-cutting, cross-sectoral approaches in country to really drive that accountability measure. I always say that workforce challenges are not only centered on health supply chain. They're not only centered to health sector. They really intersect with labor, finance, among others. So we really need to bring that cross-sectoral approaches to ensure that we can really hold the commitment that have been made at that level to a wider audience and really hold them to account. On the advocacy piece, at a global level, I think as donors, we do work, particularly on our end, I think together with others, advocating for adoption of those tools to really ensure that we are driving their uptake and their use, but also contextualization in those different countries. This will really enable us to really ensure that, again, that accountability and measurement are really done. And then last but not least, I think it's really centered around those case studies and evidence generation that we bring presented in the earlier panel. Really very important, and really encouraging countries and partners who are working at country level to document and those case studies and generate that evidence, because that's the only way we can show the impact, but also the results that can really do another cycle on getting that return on investments and further funding to support further initiatives. Over.
Thanks, Stanley. I think that is a key point that you've raised, and we all need to ensure that we sustain this aspect of it going forward. Tala, what's your perspective?
It's quite interesting listening to this in terms of how many times over the years have we had this kind of discussion where there's investment happening, a lot of things are happening. We share all the success stories one year after year, the different projects, the different programs, and funding disappears and everything disappears as well with it, which is a sad situation. And we are going through this again. And it's like sitting here thinking about it is, what do we need to do? What should we do differently beyond just thinking about we need to get more investment, we need to get more donors getting into it. And I've been on both sides of the table, I can see. As a recipient working in Gambia as chief pharmacist, working for donor like Global Fund, now being on which side I'm not even sure it is. And three things come to mind in terms of how good are we in terms of ensuring there is ownership for the ones who are using it, the recipients itself, so that we don't go and share with them what we have developed, but really try to get them to own it because they are the ones we are developing them for. I think that's one thing we need to really look in terms of how do we really reinforce that ownership. I know it's not easy. I was on part of the government side. I know how challenging it can be, but it's important. We need to start thinking about that along the terms of sustainability. Collaboration comes into mind as well. We need to collaborate. There are so many pieces. I like PtD for in the sense that it's diversity within the membership, where you have different people doing different things and they all come together. And that is one thing that we need to flag in terms of already doing that collaboration. But even more important, how do we keep on going? We just need to keep on engaging. I think most of my colleagues have said it. How do we increase the exposure? How many people beyond those who have been working directly with PtD knows what's happening with PtD? I go to LinkedIn sometimes and I see step 2.0. I think today I knew more about the step 2.0 than before. Because when you read it, it's a summary of what is happening. And you start one, okay, is this a new project? What exactly is it doing? So I think the exposure, we need to look at it, especially now where we all have to play a role. There is no more a secretariat to do the talking and the walking. So what can we do in our little corners to make sure that we keep engaged with this, we do maximum exposure and continue advocating for it. I think that is what I can see happening as we move forward.
Thanks, Tala, for that great exposition. Paul?
Yeah, thank you, Kofi. Thank you, other speakers. Again, I echo the points that were made. And in fact, I'd like to adapt some of my comments and thoughts based on the comments that are coming in. And especially, there's a whole discussion around what Jamal, John, Murtadeh, and others have all commented on. And I think it is fundamental to what we are discussing. So let me highlight that. Bring my thoughts into this and then give it back to the chair. Indeed, PtD, people that deliver, and others, there's tremendous content, processes, methodologies, great tools. And as Stanley and others also mentioned, and how we need to now adapt from a funding perspective. We were blindsided by what happened in this area. We are adapting, but now countries also need to participate significantly. We need to make sure that we are all sustainable at the unit level, at the country level, and not relying at the global level. And to do that, the comment that came in the chat was, how do we make sure, and we've said this many times before, right now when we talk about STEP and leadership, we target the CEO of the central medical stores. We need to go higher. We need to get to the Minister of Health. We need to get to the Minister of Finance. There needs to be investment, in-country investment for these products, for these activities. And in some cases, we have a central medical store with several thousand people, all of whom come from very different backgrounds, from law, from engineering, from pharmacy, from management. They all need to speak the same language. They all need to row in the same direction. They all need to provide the necessary support to the entity. So picking up on those points, I just wanted to highlight that, yes, the tools are there and they're important. Leverage more of the advocacy ones. See what all we can do and bring our conversations up to the highest level possible. Over from my side. Thank you.
Thanks, Paul. And therein lies the step 2 and the leadership training that is needed to ensure that we don't just manage, but we lead to the next level and we need to the next higher plane that we need to be. Yes, the discussion that is ongoing there is quite interesting and extremely relevant to ensuring that we move forward with this. Again, we missed the government side of the discussion, but I want to say that without the government's input, without the government maintaining and sustaining the political will and dedicating the funding that is needed, as Stanley said, the co-financing aspect of it, and as Paul said, transcending beyond just the medical stores, beyond the pharmacy departments to the ministries of finance, ministries of trade, is going to be very, very critical in ensuring that the gains that we have achieved will be sustained. We have very good tools and we have very good resources, but we all need to be available. We all need to play our role, as Stella said, to ensure that these tools get used. So I'm hoping that with the exchange, we'll be able to continue to come back here and also tell the stories. A lot of good work has been done utilizing some of these tools, but are the stories being told so that they can be picked up? Thank you all. Thank you, panelists. Can we show our appreciation by reacting? Thanks, Jacob. Thanks, Stanley. Thanks, Stella. Thanks, Paul. Hand over to Dominique. Thank you, everybody.
Okay, thank you, Kofi, and thank you to the panelists. Very engaging. I just honestly love some of the comments that Tala made around, how to keep this going, increasing the exposure, and that everyone plays a role. And that's really at the core of the PtD exchange. So we have a few minutes left, and we're going to be launching a poll. So I think, Jonathan, if you could show the poll. Yeah, thank you. So as I mentioned at the beginning of the summit, we want to hear what you will personally do to keep workforce development on the agenda globally and locally. We have included 6 answers for you, so of ease of use. So please choose the one you value the most. And they are: include PtD tools and work plans, integrate workforce development into funding proposals, advocate investments in workforce development in global forums, share PtD's evidence, tools, lessons learned with the supply chain management community, participate in the PtD exchange, and establish a mentorship program. So we'll give you about a minute to fill in your answer, and then collectively we can look at the answers. Okay, we'll give you 10 more seconds to fill in your answer, and then we'll look at the results. Okay, so it looks like about, let's see, 75% has voted. And it is a bit of a sort of evenly split. Highest percentage is in the integrating workforce development into funding proposals. So I am very encouraged to see that. And that really is what we're also all hoping, that more funding, technical assistance can be provided to countries. This is then followed by, let's see, evenly by advocating for better investments, as well as sharing the evidence, tools, and lessons with the community, followed by participating in the PtD exchange. I'm very happy to hear that. Then followed by including PtD tools in work plans, and then the mentorship program. So thank you for participating. It does give us a good indication as to what you're all feeling in the room. All right. So I just wanted to take just a minute or two to look at the evolution of the people that deliver. And as Tala mentioned, she was there at the beginning, and that was 2011. That's when the conference happened at the World Health Organization, where we had 80 organizations come together and pledge their support to the mission and to creating PtD. So since 2011, we have been operating a coalition. It was formally launched in 2019, but before that, I would say we were working as a coalition as well. And so we were convening, coordinating, advocating on behalf of the global community to building a professional health supply chain workforce. And then over the years, we have developed resources to strengthen workforce capacity. We have promoted best practices, and we have supported their adaptation and implementation at country level, both through the Secretariat as well as our coalition members. And of course, we have successfully organized 2 global Indabas in Lusaka and Bangkok, which brought together more than 250 participants from 60 countries. And so today I'm delighted to officially launch the PtD Exchange. And this is going to be a global volunteer network where organizations and individuals can connect, share, and co-create. The vision for this is really an open and dynamic community with free access to PtD tools, knowledge, while creating meaningful opportunities for peer learning and collaboration. And we want to bring you all together to tackle a lot of the questions and comments that we've seen in the chat, so that everyone can keep playing a role, that we can increase exposure to our tools and best practices in country, and then we can see uptake of these tools, resources, and also further creation of tools that are necessary for the future. The primary goal of the exchange is to sustain, expand, and promote the knowledge. But we also want to leave room for innovation and co-creation, and that's where all the members will play a very important role. We want to make sure that we are building on what has already been established. And so what truly sets it out as a special place is basically 2 principles. Number 1, that it's community first. So members shape the agenda, the activities, the future direction. No longer are we going to have a secretariat that does that. It is really up to the members to shape that agenda. And then it's open and inclusive. So participation is voluntary and it's open to everyone. Anyone that has a stake in this is more than willing to join and take an important role. And also, it's not going to be top down. This is a collaborative space where every voice matters. And so my call to action to you is very simple. Join the PtD Exchange, become part of the movement dedicated to advancing supply chain professionalization. You can register through the link provided. And also don't forget to explore all of the resources that are on the peoplethatdeliver.org. I encourage you to continue implementing the tools and approaches, to keep advocating for investments, and to help us sustain this momentum. And if you are able, please do consider supporting us through the GoFundMe campaign, as that will help pay for the hosting of the website, for community management of our new digital platform, and just for the next several years to go. And I think that is it. I will give the floor to Kofi, Professor Nato, Andrew Brown, if you have any additional comments you want to make at the end of the summit.
Thanks, Dominic. Just to say thank you so much for engaging with us. It's been a great time together. That really workforce change has multiple components. We understand what needs to be done in order to make a difference, and we want to encourage you as local champions in your contexts to do what you can and know that you have a community around you to support you. And I think we just need to move on together as we can. So thank you.
Thank you, Andrew.
Thank you, everybody. I mean, PtD is PtD, and I believe that we still have a long runway. So I encourage all of us to join the exchange and click on the GoFundMe if you are able. And let's continue the dialogue. Let's continue the exchange, because supply chain workforce is not going anywhere. Without the workforce, nothing is going to happen positively. So thank you, everybody, for your participation so far, and I look forward to seeing you all on the exchange.
Yeah, I would like to join others to thank Dominic and everyone, both speakers and participants in this workshop. I'm very optimistic that the PtD exchange will take us to the next level. So, yeah, I want to thank everyone and wish you the best.
Okay, thank you, Dr. Nato. All right, then with that, we close the summit, and we'll all look forward to engaging with you on the exchange.